Hey everyone! Today's lesson from Health Ed Solutions is on bradyarrhythmia. Don't forget to visit us online at healthedsolutions.com to certify or recertify your ACLS, PALS, BLS, or NRP 100% online. Now, let's get started. Bradyarrhythmias. What is bradycardia? A bradyarrhythmia is a medical condition in which a patient presents with a heart rate of less than 60 beats per minute. Symptoms from this condition do not usually present until the heart rate is less than 50 beats per minute. Refer to box 1 of the adult bradycardia with a pulse algorithm. Hypoxemia in bradycardia. Due to significant loss of cardiac output in bradycardia, patients will show signs and symptoms of hypoxemia. To compensate, they will show an increase in respiratory effort, i.e., tachypnea. Patients' vital signs must be monitored with special attention to oxygenation and ventilation. A pulse oximeter is recommended to monitor arterial oxygen saturation. When a patient shows signs of hypoxemia, such as low oxygen saturation less than 94%, provide oxygen supplementation at 100% FiO2. Close monitoring is recommended at this point with a cardiac monitor. A 12-lead ECG must be performed. Intravenous access is likewise recommended in case emergency medications are required. With all of this information, the clinician attempts a possible diagnosis of the patient's medical condition. Refer to box 2 of the adult bradycardia with a pulse algorithm. The next questions to answer are: 1. Are the patient's signs and symptoms of bradycardia cardiac in origin? And 2. Is there any other clinical condition that might have brought about bradycardia in this patient? The answers to these questions lead the clinician to interventions he or she might choose to treat the patient. Stable versus unstable. If after providing oxygen, the patient's symptoms improve, then the clinician may opt to monitor and observe the patient, either in the ED or on a cardiac ward. If the bradyarrhythmia is persistent and the patient remains symptomatic or becomes unstable, the clinician determines if the patient is hypotensive, has an altered mental status, signs of shock, ischemic chest discomfort, or acute heart failure. These are severe conditions resulting from the bradyarrhythmia. Refer to box 3 of the adult bradycardia with a pulse algorithm. For example, a second-degree atrioventricular block, or Mobitz type 2, can cause severely decreased cardiac output, which can compromise coronary blood flow and lead to acute myocardial infarction. This example highlights a symptomatic bradycardia that is directly related to the slow heart rate. Refer to the ECG interpretation section of this course. AV blocks. Atrioventricular blocks can be caused by acute myocardial infarction, medications, or electrolyte imbalances. First-degree AV blocks are often benign, and ECG findings will show an increased PR interval of more than 0.20 seconds. Second-degree AV block, Mobitz type 2, blocks impulses below the AV node within the His-Purkinje system. This type of AV block almost always causes symptoms. It is commonly associated with acute myocardial infarction and may transform into a third-degree AV block. Characteristic in this ECG tracing is that the first and second prolonged PR interval has a fixed duration followed by a QRS complex, and the third QRS complex is dropped. Third-degree AV block occurs at the atrioventricular node. The atria beat at their own rate, while the ventricular rate is determined by a junctional or ventricular pacemaker. The P waves march through and are unrelated to the QRS complex. The third-degree AV block may be permanent or transient. That's it for our lesson today. Thanks for watching, and remember to check out our website at healthedsolutions.com for more free content or to get certified or recertified online.